my God, it's Hannah. Hello. Hello, is anyone on the line?
I am.
Hi, this is Hannah Chu from Erie Family Health Center.
Hi, this is Victor Alos, one of the presenters.
Hi, this is Eileen from Sinai Urban Health Institute.
Hi, welcome.
Hi, Emma Matias from Cook County Health.
Hi, Emma.
Webb from Cook County Health.
Hi.
Hi there. Can anybody hear me?
Yes.
Yes.
Oh, great. Okay. So I was covering part of our agenda. Did everybody get that?
No.
No? Okay, I apologize. This is the first time we're facilitating in this format, so I apologize. We knew we'd be working through some technical difficulties, and I think that we just encountered our first one. But hello, everybody. Thank you for joining us. This is Lucy Flores at IPHI, and with me are Rocio Lozano and Rebecca Gordenstein, who I believe most of you all have met during other meetings and our work together. So additionally, Victor Alos, who is our subject matter expert and will be our facilitator today. Victor, would you like to do a brief intro of yourself?
Briefly, I have been, well, first, welcome and happy Monday after a long weekend. Briefly, I have been working with diabetes prevention programs, community-based programs since 2010, 2011. I am a life coach. I have my own groups in Spanish and English, both. I am also a master trainer for the diabetes prevention program for both programs, the one from Pittsburgh and also for the one for Emory. So I'm very glad that I can share my experiences and looking forward for a very productive number of teleconference calls.
Thank you, Victor. So I'd like to review our agenda and talk a little bit about the purpose for this collaborative. Many of you have already interacted with some of this content because we met during the June 5th and 6th lifestyle coach training that we participated in, but about half of our other participants have not seen this content because we didn't go through the training together. So I just want to touch on some of these topics briefly. So we'll cover a little bit about the purpose of the collaborative. We would like everybody on the phone to introduce yourselves, your organization, and prior experience with lifestyle coaching or similar experience. And after that, I think we'll jump into what we think is the meat of this collaborative meeting, which is participant recruitment and retention, and then cover some Q&As. And we would like to hear from you what other topics would be useful to cover in future sessions, and then of course cover next meeting updates. So thank you. So the purpose and the main goal of our learning collaborative is to facilitate the exchange of knowledge and experience to support lifestyle coaches in developing quality programs within our DPP partner organizations. And we really anticipate and are looking forward to the exchange of some of your past experiences with DPP. I'm going to be showing you a couple of slides that identify who all is participating in this network, whether those organizations are on the call today or not. But we have a number of organizations that we're working with and a number of individuals within those organizations that we hope that as we cover this content and you have this in the back of your head, you'll be identifying what connections will be most useful to all of you through this collaborative. Part of our expectations is that everyone will be able to join us for these sessions while we know that teams are busy and that this is an investment in time and a commitment, we really hope that, if not all, that most of the individuals from the organizations that are participating and that are lifestyle coaches will be able to join us, and that there will be some cross-sharing among teams from within the organizations that are joining us. And also that will help inform and participate in our evaluation activities that you will all learn more about once our evaluation team starts reaching out and sets the performance measurement tools and evaluation details, which are currently under development and that we will be sharing with organizations shortly. So I think that you're looking at a slide with the organizations and the number of programs that are currently being kicked off. And so as you can see, there's about 19 DPP programs within the city of Chicago that are underway in some planning phase and some implementation. And so you all see that you have a number of colleagues within a pretty awesome network within the city of Chicago that includes community-based organizations, health and hospital systems, and FQHCs. And while you don't all look alike and work alike, we really do hope that some of the experiences and activities that you will be carrying out through implementation of this, that you will share with other organizations, and that we can talk to each other about what's worked, what hasn't, and why maybe something worked really well and why maybe something didn't work really well. I think that we learn as much from our challenges as well as our successes. So we at IPHI are definitely looking forward to learning from what some of those challenges are for organizations and our coaches, because we know that the success of a great program, it really largely hinges on the success of a great lifestyle coach. And so it's our mission to support you in that work through this collaborative and through the technical assistance that we're able to provide for you. Next slide. And this other slide just identifies who all at the different organizations are your sort of colleagues, right, in this work, because this is a list of the lifestyle coaches that are operating within those organizations that we just looked at, and who all those people are. And you could either do a print screen and capture this information, or we will be happy to share these slides with you once we are done with this session today. You will definitely get this so that you don't have to try to remember who all was on. But as you hear people speak and I guess provide insight and comments, you'll have an understanding of who all that is and who from the organizations that are represented in this collaborative are participating. And I think that I would like to ask if anybody has any questions before we jump into the meat of the program. I know. Okay, so I don't hear any questions. So I think that we can jump in, and if anybody has any questions, we will definitely have time to cover those at the end of the session, and or Victor may welcome some of those questions during the content that he covers, but I'm happy to defer to your preference, Victor. So it's all yours. Thank you.
Okay. Okay, I guess welcome again. Very happy to be here, and I hope you can actually see the full screen of my slides.
Victor, I'm so sorry. Can we go around and have individuals introduce themselves, their organizations, and their prior experience with this work?
Sure, no problem.
Hi, everybody. Do you guys want to jump in?
Hi, I can start. This is Abraham Celio from Universidad Popular. I'm also joined by Cristina Perez and Olivia Ramirez, our lifestyle coaches. And we previously have been working with the Promotora-led DPP program for the last 3 years, and are very excited to start collecting this data through a recognized CDC program.
Hi, hello, this is Lynette.
Go ahead.
Hi, this is Lynette from LKC, Health and Wellness, and I have been a lifestyle coach for approximately 1.5 years now. And we have done various cohorts with medical centers as well as churches, and I work directly with Advocate Aurora.
Hi, this is Casey from Near North Health Service Corporation. I'm joined in by Kyra Jackson as well. She's our lifestyle coach here. She was trained for the lifestyle coach training with DPP, but this is our first DPP program that we're implementing here at Near North, so we're excited to get this thing rolling. Thanks.
Hi, this is Hannah Chi with Erie Family Health Center. I am a senior community programs manager at Erie, and unfortunately our lifestyle coaches were not able to join this call today, but they are looking forward to getting our next group started in August. And we previously were able to launch one group last year, and so we're looking forward to this next group under Chicago Cares.
Hi, my name is Sheila Harmon. I'm with UI Health Miles Square. I did complete the lifestyle training coach with this organization. This will be our first DPP cohort, and we're looking forward to getting started. I am a certified diabetes educator, but this will be our first DPP cohort, and we're looking forward to starting.
Hi, this is Shamika Irby. I'm the program coordinator and lifestyle coach at Howard Brown Health 63rd Street. I'm joined with Magda Holbert, our Chief Clinical Officer, and we have completed one cohort so far, and I'm looking forward to starting our next cohort in September.
Hi, this is
Hi, this is Dr. Holberg from Howard Brown. And I'm interested in diabetes. I don't, so I'm interested in this project.
Hi, this is Danielle Wells from Mercy Hospital and Medical Center. I'm the site coordinator for the diabetes prevention program, and I'm also a trained lifestyle coach. I'm in the process of teaching my first cohort. We are in week 11, and we're looking forward to starting more cohorts this summer.
Hi, this is Jonas Hamren from Heartland Health Centers. I have myself worked with lifestyle changes for many years, but this will be my first DPP program.
This is Jacqueline Carson from Christ Medical Center. I am a master trainer for the DPP program, a certified lifestyle coach, and have been facilitating classes for the Christ Medical Center since 2017.
Hi, this is Elba Serna from Erie House, and this is going to be our first cohort.
Hi, this is Olumide Igor. I'm from Advocate Trinity Hospital, and this is my first cohort. I've been a lifestyle coach for like a month, and we're in the process of recruiting participants, for the DPP program at the Guadalupe Senior Home. and I'm looking for something, exciting. Very, very happy about what lies ahead.
Hi, this is Jackie Webb. This is my first DPP cohort, and I've been a diabetes educator for the last 3 years.
Hi, this is Webster, Cook County Health. Jackie Webb, Anita Abram, Larry McDonald, and I believe Emma is on the call as well. And this is our first cohort for DPP, so we're all excited. I can't speak to everyone's specialty when it comes to diabetes, but as Jackie mentioned, her experience, Anita's has specialized in diabetes. She's a nurse on our team and so forth. So we're excited.
I think we are missing someone from Suhi. Is anyone from Suhi on the line?
Hello. Hi, this is Aideen Okan. This is from Sinai Urban Health Institute, aka SUI, and I'm also a lifestyle coach, and we have started our first cohort this month. No, June. So, yeah, this is our first one starting.
Anyone else on the line that has not had a chance to introduce themselves? Great. Thank you all so much. And Victor, I think you can take it away.
Thank you very much. And again, welcome. Briefly, let me tell you what I did for this conference call or webinar. We look at a survey that we sent before. You can see the graphical portion of the survey at the end of the screen. And most participants told us that they were more interested for now in recruiting and retention. So I base my presentation for today on those two topics. What I did, I looked for information in different sources, and this is what I'm going to show you, a combination of opinions, publications, expertise of life coaches around the United States from both the program from Pittsburgh, the GLB, and the program from Emory, DTAC. In addition, I did a search of the literature. So these are the topics that we have in terms of priorities based on the survey, and I added a couple of slides regarding my sources of information. I added something about readiness, participants' readiness, in addition to recruitment and retention. So the main sources, like I have in the slide, you will see the Diabetes Training and Technical Assistance Center, DTAC, at Emory. It's called Common Grounds. I'm not sure if you have been able to log into it, but it provides a wealth of information. You can exchange ideas, questions with your peers. And this is a monitored blog type of venue, very, very useful, very, very well visited, and a lot of participation. Something like that is also from the University of Pittsburgh Diabetes Prevention Support Center, which is the second one right here, and these are the links. I also got information from CDC, the National Diabetes Prevention Program, very good source of information, and like I mentioned, lead search and peer review publications. So let's talk about readiness from coaches. Do I want to do this? Do I have to do this? Do I believe in the program? How do I feel about the community? How do I feel about this program? Do I have all the tools that I need to do my job? And in addition, what are the characteristics of organizations and life coaches that successfully implemented the diabetes prevention program in my area. So these might be questions that you might want to think about every now and then. Definitely when I did my first group, I was eager to do it. I was part of a team, research team. I was getting paid to do this. But more than that, I really wanted to do this. It felt very, very good. So that was the prime driver for driving and meeting in different places and looking at the materials and all. So I included this slide about participants' readiness because you're going to see in the literature, the expert opinion, that it needs to be done. It's because you don't really know how many people are actually ready to move and change their behavior. So you might recruit 15, 20 participants, and sometimes you end up with less than half of that by month 6. And you wonder why. So you might want to look into some type of readiness for tools for participants. And there are, I found a number of them, very long ones, mostly in clinical trials about weight loss and physical activity. But I found 2 short ones that I think might be worth taking a closer look. And this is the one that this is the short one, both in English and Spanish. This is the one that you might want to introduce during your initial orientational session or session 0. So it's very simple, a couple of questions. For example, let's look at the question right here. In the past month, have you been actively trying to lose weight? Yes or no? So depending on the question here, question number 1 is a no, what the participant answered. And then you tally up if they have questions number 1, number 2, number 3, a negative, then this will tell you that this patient is not considering to lose weight right now and maybe might be ready in the near future. So this is an example of this type of short readiness survey. This is the one that I found from DTAC, this is the Emory Training Center for Diabetes Prevention Program for life coaches, for master trainers. This is in Atlanta. So this one is 2 set of questions. The first ones are about eating habits. The second one about physical activity. Then they answer. Let's look at the question. I have not been, please circle the statement that best describes your current eating habits. So if the person tells you, 2, I intended to eat healthier in the next month, then this person is in the contemplation, right? Now, the same thing applies for the second question regarding physical activity. You look at the type where the stage is. This is in the pre-contemplation, contemplation, depending on the number on the question that the participant selected. Then you have your key here for what to do regarding pre-contemplation, what to do with someone who is in this stage. This is not the person that is not ready to change. So it's very straightforward. I think it's very useful, but I think it will reinforce the notion in participants that you need for them to understand how important it is for them to commit their time, to make a serious commitment. Talk about that a little bit later. Now, this slide shows some brochures from CDC, and down here's the link, so you can just click and get these. This is just 1 or 2, but they have for brochures for recruiting participants for different audiences, and they have this in small or just large pamphlets. This is an example of one of those, both in English and Spanish, and this tells you tells the participant about the program, what it will do, what the eligibility criteria right here, and very important, what participants are expected to do with the program. So you can use this as this is just an example of this brochure from CDC. Now, I found your next couple of slides, you're going to see recruitment and retention tips and lessons learned from CDC. And then after that, you're going to see recruitment and retention slides from the literature and from the Emory Life Coaches experience and the Pittsburgh Life Coaches experience, the blogs. And you will see how there's overlapping. So CDC tips are evidence-based on people publications, a good number of these from clinical trials addressing behavioral changes, addressing weight loss and physical activity. So let's look at this quickly. Recruitment tips from CDC. This is, I found this very interesting. Begin early, 3 months in advance. Address logistical barriers early. Do you want to provide the training sessions in a place that is close to participants' homes? Are you providing training sessions within the inside a hospital? How participants feel about going to a hospital for training sessions and classes? CDC recommends also offering a session zero. Session zero is the informational session, which you're going to offer participants to learn about the program, and also you will participants will learn about the expectations from participants, specifically how number of sessions attended and the importance of attending every single session, and maybe writing the food diaries and so forth. So this is what I think has been very helpful in my experience to go where, provide the training sessions where your target population is. And this makes sense. But if you want to recruit, you want to also recruit in different venues where they gather, where they have screening events like health fairs. And this is very, very true. Encourage current and previous participants, word of mouth, to refer new participants to your program. Very helpful. That's a powerful marketing practice. Another recruiting tip, share examples of stories that have been used to promote the program, word of mouth. And who can better provide that participants that graduated from the program, which, by the way, you can bring to your session zero or your informational session. Another recruitment tip include a variety of local partners in the referral network. So you're going to spread the net as wide as you can to recruit eligible participants. Hospitals, faith-based organizations, community-based organizations. And you're going to see, you already know, some of you, that the organizational support, how organizations help you recruiting, maintaining participants, it's key, it's very important. How participants feel when they enter the rooms of these organizations, how they are treated by the receptionists, all of that will make a world of a difference regarding recruitment and retention of participants. Communicate and engage frequently with participants and also with the physicians that you're going to see if you can get referrals. By the way, referrals from physicians is also critical for recruitment purposes. It makes a world of a difference. You might also, in some cases, if needed, you can provide support for the physician's practices regarding screening, testing, and the referral of eligible DPP participants. These two are very common sense. Employers and marketing resources, provide employers with marketing resources, maybe a little letter, and all of this trying to recruit participants from different venues. Now, this is about CDC retention, okay? Now, retention strategies. And you're going to see some of these repeat or similar in the other slides in the near future. Let's look at this one. Assess commitment and readiness to change prior to enrollment of the program. That tells you about readiness of participants. That is why there are so many tools to measure readiness from participants. If you don't have the time to do that, well, the best way to do this is during the informational session, session 0. Now, the other thing is quite important. Session 0, sign a commitment agreement before enrolling the participant. That's psychologically will work very well, but it shows how serious the commitment needs to be. They need to understand this is a long-term commitment, and they need to be willing to participate as many classes as possible. The more research tells us, the more sessions attended, the more likely the goal in terms of weight loss and physical activity and preventing diabetes is achieved. So the more sessions attended, the better they are. Now this one I found quite interesting. Encourage self-pay sliding fee scale to strengthen the buy-in. So this is quite interesting. I did it myself, but I got the hint that when everything is free, it doesn't have the same perception of value when there is a commitment of paying for something. So I take this quite interesting. I never did it myself. Maybe I was naive. I help in some situations. All the interactive and exciting events. This is when you're actually performing your DPP classes. You can bring people from the community that might be willing to volunteer their services, expecting nothing back, just to help you in the program.
I just clicked it.
Past participants who can share insights. That's excellent. Very strong motivator to keep participants with the program. Non-monetary incentives. They work beautifully. We do this all the time. Have raffles at the end of the session, and people are looking forward, and I think it makes a difference. I got this one from one of the experienced life coaches from Emory. At the maintenance session after the 7 months, offer more than 1 monthly session. Depending on your program, this is something you might want to look into. Call or text participants between classes. I do that. I keep in touch with them different ways. Group texting via Google Voice. I also discovered, well, I haven't discovered, but I use Audacity. Audacity is a voice software, free domain. It doesn't cost you anything, but it allows you to record your voice with short messages, long messages, and then you can send these via text to your participants so they can listen to your messages, refreshments, or reinforcers. They can listen to them in their phones, iPads, or phone lines, or computers. Something to consider too. Encourage connections among participants, makes sense. Offer makeup classes via telephone, and depending on where you are, this might have relevance. I think if you're already listed as a supplier for Medicare diabetes prevention program, they do limit the makeup classes numbers by phone. So, and by computer. So that's something to think about. Establish buy-in and support from the leadership. This is so important. If the leadership in your organization doesn't believe in the program, is not helping you, doesn't really embrace the program, it is going to have a ripple effect on your participants. It will. So you need the buy-in, the involvement, the ownership of the key leadership and their support. So it's important that the CDC recommends this, that you keep ongoing communication with the CEO of your organization, whatever is more appropriate. If you're working in a church-based group and you're having the facilities provided by the pastor, with that would be the pastor. So it makes sense. And these are tips from CDC, and it does make sense, and I can tell you that based on my own experience. Convene groups of life coaches to share their experiences. We did this in the clinical trial, call it debriefing every week. We got a number of coaches share their experiences, and we learn from each other. So it might be a very good idea to have some type of debriefing sessions, maybe not weekly, but every 2 weeks among your life coaches within your organization, and maybe within your group. Share experiences, lessons learned, questions, share the load. Training bilingual life coaches, and supplement English curriculum with Spanish language handouts, and I think there are a good number of them. Recruitment again. Now we're looking at what is in the literature and also in the life coaches blogs and internet websites from their experiences. So let's look at this public service announcement. This is for recruitment again. Now we're switching back to recruitment, but this is from the literature. Public announcement on local radio and television station, newspapers, and mailing. So it's the whole thing. Very long net. Community coordinator, mailing letters after call, word of mouth. You see, like I mentioned, it overlaps. Word of mouth from existing friends that are participating in the program, and use of existing resources. It does work. Churches, organizations, pastor recruitment. Help get assistance from your pastor, your church leader, to announce for recruitment purposes at the Sunday service, the Saturday service. Also, paid health advisors, promotoras, community health, excellent recruitment. Community sites and events, churches, and so forth. And recruitment tips from CDC. This one is very interesting. Offer more support to participant rates. That makes sense. So if you're going to start with just one, you might want to, if possible, start with more than one group. We did that. But we had more life coaches, so we were able to recruit more participants. Reducing barriers of participation is very, very, very important too. And by that, we had daycare, we provided transportation. We tried everything possible within our budget and resources to alleviate the barrier, the load of participants, because most of these participants, they have complicated lives, complicated family situations. So you have to be aware of that. Another barrier that we were able to reduce, we established early on linkages, referral linkages for participants that might need behavioral health. We got open referral channels, and we found that there were some mental health, behavioral health issues within the participants, domestic violence to be more specific. And in the middle of the session, this person just confided with the life coach, and we're able to help that person, and it made a huge difference. Okay, so going back to the, this is the lit search that was about recruitment, like I mentioned. Session 0 again, monthly session 0, monthly informational sessions right here. I was not aware of that. And this is, again, experience from life coaches telling other life coaches what they have done in terms of recruitment, and it's working. Again, and you can see how the CDC overlaps. I'm very sure that CDC information came from the lit, so that's why the overlapping. Targeting advertisement where men congregate. If you're recruiting, if you want to recruit more men, you might want to. There's one group that's recruiting men from the Police Officers Association, and it's very, very, very successful. So when your target population congregates, that's where you want to recruit. Champions of the DPP also, and against the usual medium, social media, and so forth, depending on your participants. My participants, some of my participants, they don't have all the resources that maybe someone might have in your area. They don't have the ability to get into Facebook or Twitter or computers. They have just cell phones. So we have to work with that. So I changed my venue to they can actually access my information via their cell phones. So this is what an information or informational session or session 0 might look like. What would you like to do? And it's basically 3 components. What is this program going to do for me? What is it as a participant? What will I take out of this program? Very plain language, very concise. Then the other thing is, what is expected from me as a participant? What are the roles of the life coaches? As a participant, then you have to go through the main areas. Commit to change in the way you eat and the physical activity level. Actively participate in the sessions, and then you can throw in the lessons learned from the life coach that the more sessions attended, the more likelihood that you will be able to have success. Track and record information as requested. This is another thing that is expected. So you're going to tell them in the information session, the session 0, all of these things right up front. No surprises. Time commitment, we're going to do this and do that. So it's very important we do that. Retention, and again, this goes back to the literature and life coaches' lessons learned. From the literature, lower age, lack of support person, translates into failure to start with the program. So these are likelihood, some characteristics of the target population that will be a reason to a factor to fail in terms of the program. Attrition will drop out. Dropping out was associated with younger age and tobacco use. And these are things that you want to have as information and knowledge. It doesn't mean that it's going to be, it will apply to every participant, but it's good to know why things do happen, why we have problems with retention. Some of the root causes are right here, published in the literature. Attendance monitored, supervised by researcher or intervention leader makes a difference in the adherence. That is so true. When I was monitoring the DPP activity classes, I was able to interact with participants too. It makes a difference. Social support also improved adherence and retention. Clear expectations on the front end, session 0. You can see how this session 0 keeps repeating again and again and again. Assessment of participant readiness, again. Regular class reminders, phone calls. It makes sense. I do that. Quality conversation during sessions. And now let's talk about a bit about that. Everything begins with you as a life coach. How deeply sincere you are about this. How you feel about what you're doing. But in addition to that, this technique during the first 5 minutes of your next class, you ask the question, how are they doing? Did they have any problems with the assignment, take-home assignment from the previous session? So this quality conversation, very short during the beginning of the next session, makes a lot of difference, and it will help to keep your participants. So why do participants keep coming back and for 1 year and others do not? This is what we're trying to address right here. Tell participants in a week that we needed 8 to hold a graph. So what is that about? This is one life coach, and this during the informational session 0, he told the participants that they needed to have some type of quorum to keep going with the class. So that stresses the point in participants that their participation is key, and it also will affect the other ones. So this is what she said about that. Individual intakes with readiness questions, ask questions about anticipated barriers. This is, you do all of that too in the informational session 0. Lots of group engagement and contact between sessions. Again, incentives, readiness to change. Now, this is really, really important. Asking participants if they can tell you or they can foresee missing more than 4 classes. Okay, up front, maybe in the first session, maybe session 0. If they say yes, then this might not be the right time to start this program. This is one opinion from a life coach. Include them in a waiting list, and in a later date, check their time commitment. What I would add to this is that let's say that they say yes, I think I will not be able to, I anticipate not making it to every class and missing more than 4 classes. I would ask if they're willing to provide some ideas about the reasons why would that be an issue. And then depending on your time, you might want to explore those. Why are they telling you that they're going to miss 4 classes? You might be able to help them to find a solution, or maybe not. Regarding retention, this person said that this helped with retention, and that is ongoing monthly informational sessions, session 0, monthly. I don't do that, but this person said that it helps with retention. Monthly informational session with a champion, a graduate from the DPP program, asking not to enroll if they know that 2 or more sessions will be missed. It depends. It might work in some places, it might not work, but I'm just sharing with you what I found from lessons learned from the life coaches, and this one is from Emory. That's why the next 12 months might not be good time for participation. And again, what you're trying to do is find ways that you might be able to help them with the barriers presented so that they can participate. Now, this one is key. Adhere to the curriculum. That is so true, and I learned that painfully the hard way. If I try to not to follow the curriculum. If I, for some reason, decided to, I'm not going to say that, I'm going to change this session with this, it will come back and bite you. So I learned the hard way that, yes, you have to stay with the recipe. You have to keep faithful with the curriculum. Another tip, send them birthday cards to participants. That is being done by the coordinator if you have one. You have someone to help you with calls, weekly calls, and so forth. Retention, well, this is one I found very interesting. This is during session 0 to add a motivational interviewing session regarding retention. And basically, very quickly, you divide your session, your group, in 2 groups of participants. Then you ask them to write 2 pros against participating for the full length and 2 reasons for not participating or just starting with a program for the 12 months. Then you bring the groups together and ask them to share results. And it was quite interesting how this method began describing what is against the cons of not joining the program right now. So you begin discussing that. Then you talk about the pros of not joining the program. And then the pros of joining the program. So what interesting dynamics, and all of this is done with a purpose. And of course, if you have the time or the inclination to do this in your informational sessions here, that would be great. So the purpose is to encourage participants to think through all the negative and all the positive of enjoying the program right now or just postponing it. These are my list of resources, and if you want to look at the CDC ones at the top, at the bottom, with a hyperlink, this is for recruitment and for retention. This is our recruitment brochures, and of course the CDC National Diabetes Prevention Program. Lots of resources, tested, evidence-based, that you might want to adapt to your present environment. And the 2 main links, this is the DTAC from Emory that I was telling you, Common Ground. This is what life coaches will share ideas, problems, solutions. And likewise, then you have the other group of life coaches, master trainers from Pittsburgh. So these are the web links and how you can join them. If you want the basic statistics about diabetes prevention facts, right here's a quick link that you can access and talk to participants a big picture about that. These are my references right here, a bunch of them with the links. So for your, if you want to double check them, you want to get more information, read the full publication. This is a map that I made in June 8th, last month, from the CDC National Diabetes Program, Award Recognition Program. These are a map of the local organizations right here, registered organizations, and mostly right here and not so much on the western side of the area. And the contact information, and this one, as the data I downloaded the data, the STAR, which is a full recognition award, 2 of them, and then blue one has preliminary recognition, which you can actually apply for Medicare services, contact information, and so forth. And that is basically it. Now we have time for some questions, and any questions will be, I don't know if you want to express them right now. Now, I also would like to add that I offer the venue of if you think about any questions after the conference call when you're actually working with your groups and you would like to share that, then I suggest you might send the questions either through Lucy or Rocio, and that way it will get to me. later we can decide if we want to create another venue like a blog, a website, or something like that. So now I would like to hear from you if you have any questions. Now is the time. You can unmute your phones, and then if you have any questions, or if you want to type questions on the board, on the chat, you can do so.
Yeah, so this is just a general question. Are we going to be able to get a copy of the slide?
Yes, we will be sharing the materials reviewed today.
Okay, thanks.
Emma, is there a question you would like to ask? We noticed you have your hand raised.
Emma, your microphone might be muted.
Sorry, that was a mistake.
Okay. Well, this is Victor. I encourage everyone to share their questions, concerns, suggestions with the group or in some type of venue so we can all learn from each other. We can help each other. I truly believe that you're doing an outstanding job, and I believe that everyone is very sincere in mission to get this program up and running, and I hope that we might be able to help you. So the next time, like maybe in a year, we might be able to see more dots on that map that I created regarding registered organizations providing the diabetes prevention program.
Victor, we have a question.
Yes.
We have a question regarding any additional motivational interviewing materials that could be shared or recommendations to work with participants around motivational interviewing.
Yes, I do love I welcome the question, and I got really interesting on motivational interviewing when I began putting these slides together. So yes, I have a number of ideas that I will be able to share. I will also would like to share the title and author of a book about that. And I will be happy to send that to Lucy or Rocio.
Thank you.
But regarding motivational interviewing, the exercise, the brief exercise that I use in my slides will help you to do it very quickly in the informational session. But definitely I will send you more information on the topic. It's fascinating how it began in the 70s and how it has been applied in different disciplines. It is fascinating. And very like the way that DPP material, the curriculum is being designed by psychologists, it leads the opportunity for the participant to engage in the solution of the problem. It is fascinating. So I cannot say enough about motivational interviewing.
Thank you. We have another question. It says, for existing cohorts or the ones starting, how many participants did you reach out to? And then how many stayed and committed to the program?
the line was breaking up. Well, can you repeat the question again, please?
Yeah, I think this question is for anyone who is already doing some of the DPP programming. So it says, for existing cohorts or ones starting, how many participants did you reach out to? And then how many stayed and committed to the program?
Yes. Well, it depends. I've been working with not my groups, but at least 7 groups in different locations. So let me tell you about my own experiences and then the experiences of my peers nearby. When it comes to Latino populations, we learned that we needed to recruit a larger number of participants because, and you will find this in the literature, the attrition rates among Latinos is higher in the DPP program than any other ethnic or racial group. So that is true. If I learned about for example, my last group, which ended in April of last year, but we kept going on. I had a very good retention rate. I think I ended up with 12 that participated in all 12 months, 12 to 13. Now, I started with about 19, almost, I think sometimes it's well up to 25 because I had some people that joined later, but I got 12. That is quite a bit because all of them were Latinos, and I still get in touch with them. But that is not the case with every group. Some groups experienced severe attrition. They started with 10 and ended up with only 2 at the 12 months. So you have to be aware of that, and I think that it's so important to assess the readiness of participants and also to clearly tell them this is what the program is about. We need your participations doing ABC meaning attending classes, registering your food and activity levels, but mostly attaining classes. If you don't do that, this will not work for us or for you. So it is very, very important. The other thing is the referral. When we had a group that was referred to us by a physician, we got a lower attrition. We got more retention than when we had a group that was not referred by participants, that was recruited some other way from a list, and it made a huge difference. So these are the facts. It is a very difficult sometimes to assess how ready they are. Your best tool will be to be very sincere upfront and tell them just what we talk about, how this program works and how important it is for them to stay with the program. We also offer makeup classes via telephone and virtually by the website that we created, and they can listen and they can watch makeup sessions in videos, short videos. So all of these things are possible, but retention among Latinos remains a challenge.
I'm wondering if there's anyone that has already done some of this, for example, at Howard Brown Advocate or Mercy, if you have any comments regarding this topic of how many individuals did you reach out to in relation to how many you enrolled and how many completed?
So here at Christ, our first cohort started out with approximately 18 people. But the positive thing that helped us was that we had a physician that we were working with, Dr. Tony Hampton. So he referred his patients. Before there was conversation between myself and the participants, his medical staff or somebody on his medical staff actually called to talk to the individuals as well as remind them of the upcoming Session 0 class as well as the starting of the program. So once we finished with that first cohort, I think we started with 18. We finished with about 15. Part of what I would say was that made that very successful was that the fact we held the class in the conference room of his office. So periodically he would actually stop in, talk to them individually, ask them how they were going, how was the program going, and that was an incentive for them to come because they never knew when he was going to show up. But they did well from the beginning to the end of that particular cohort. So currently, now that he's done well with our program, of course he's very busy now, but I'm actually in conversation with other physicians because I think for us, even though we host our classes off-site, having a physician champion has been critical for us. Also, I kind of serve as a team lead for the whole DPP program in the South region for the system. And so even for Trinity, they have a physician champion that has been helping them as well. And I know at South Suburban, they actually, I think, have been working with their diabetes educators, or they have a diabetes education clinic, I think. So they are getting referrals from those individuals as well. But we have found working with congregations of faith has been beneficial for us as well as working with our physician champions.
Thank you, Jackie.
No problem.
Anybody else want to comment before we move on to another question?
Just to reinforce the notion of weekly reminders. It is so important for retention purposes. It is so important to sincerely call them, text them. When we have a coordinator that is helping me as a life coach with all of those things, it makes a world of a difference. The coordinator, if the person is let's say, identifies with the participants in a very good way, the high likelihood that this person will get the participation and retain more participants. So weekly reminders are very important, and there are many ways to do that, but you definitely need a warm human body sincerely calling them, reminding them in a very, very nice way.
Thank you, Victor. Anyone else? So there's another question that asks, are there any phone apps that cohorts have utilized in their groups or any other type of technology? And again, this may be useful to hear from any of the organizations that have already facilitated cohorts that technology has been part of, or cohorts that are planning to use technology. So it sounds like that may be a no. And
well, not really. Not really. We remember some of my participants are not extremely computer savvy. Their mobile phones are not the top of the line. They have limited resources, complicated lives. But what I was able to find, I did a video for them in Spanish and English about how to use MyFitnessPal, lifestylecoach.org, not the one that you have to register, but the one that you can just type the food name in Spanish or English, and you will get the calories and the grams of fat quickly. And that app was very well accepted by my participants with limited proficiency in computer and literacy, and they were able to use that very well for their food diary. So that one, I think, it's very helpful. The other one is that I mentioned is using group texting services, and there are many of them.
I'll add that at IPHI, we are considering offering Sidekick Health, which is a phone or technology. It's a downloadable app that can be used in order to interact between lifestyle coach and participants. It would also offer the lifestyle coach a dashboard that would be able to help the lifestyle coach see sort of, participant interaction and, have participants submitted food diaries, because food diary and the physical activity tracking is possible via Sidekick Health. And the dashboard would offer the lifestyle coach an overview of where participants are at. Obviously, it hinges on individuals using it and interacting with it. And we are going to be scheduling a demo for organizations that may be interested in viewing it and then making decisions around whether it's something they believe their participants may be able to use and whether it would be beneficial for participants. And I think that one of the challenges is initially IPHI through the CDC funding would be able to offer this to programs at no cost. One of the considerations for future would be ongoing costs for use beyond the 2-year funding period. So it goes towards program sustainability, right? How are programs going to continue to be offering DPP beyond the initial 2-year funding that is offered through IPHI and subsequently the Sidekick Health app. So we do acknowledge that similar to continuing DPP programming beyond this 2-year period, organizations would have to consider the financial feasibility of offering this beyond this 2-year funding period. As many of you know, IPHI is working on getting Medicaid and MCO reimbursement for this service. However, this is a 5-year project, and we expect that Medicaid reimbursement for this service or this program, it will take us some time to be able to transact or achieve that, if we're able to achieve that in the future. So just something to consider. I have spoken with many organizations at this point regarding work plan implementation, and if we haven't spoken, you can expect to speak with us in the coming weeks. And I've asked everyone if they are interested in, who's interested in demoing the Sidekick Health app. And so we will be reaching out once that is scheduled to our partners who have expressed interest in wanting to demo it. It is an English-only platform, so that is a limiting factor that will, obviously not serve our Latino Spanish-speaking only population. And I know that there are a number of programs that are going to be facilitated in Spanish. So again, it may be less useful for those organizations and those programs. But if you're doing English language programming, it might be something that you're interested in. So feel free to send us an email if we haven't spoken to you and you are interested in that, because we can definitely keep you on our list of organizations that are interested in demoing it or viewing the demo, sorry. So I just wanted to say that. This is Lucy at IPHI. Anyone else have comments or experience, either, like a positive experience or a negative experience with technology use in any of their organizations' past programming? Okay. Victor, is there anything else that you'd like to add? We are at 2:17, so we have just a couple of more things to cover on our end that are basic administrative, so I just need a couple more minutes. Is there anything else that you would like to add or comment on?
No, just to offer my sincere wishes that everyone will do a very good job, an excellent job. Don't forget, the curriculum is your best tool. And then these things that we're sharing today, just something to think about, will help you. But as long as you're sincere, you prepare yourself for the session, they will follow you. And I wish you well. Please send any type of question about anything about the diabetes prevention program, anything whatsoever. I will be happy to look at these once I got them.
Thank you so much, Victor. I don't see any additional questions in our chat box, but feel free to send any. We're happy to answer those. And of course, after this session, we're happy to continue to send questions to Victor. I do want to ask you to complete an evaluation or a brief survey regarding this session that we will be sharing via email with you, and as well as let us know what other topics you'd like to cover. Victor, through that survey that he did that you all completed, was able to get a pretty good understanding of what all organizations are most interested and concerned about. And so there are a number of top 5 topics that we will be covering. But of course, as programs are moving toward implementation and beyond that planning phase, we understand that you may have other questions that come up, and we are happy to troubleshoot through those. So just a reminder, our next meeting is Tuesday, August 6th from 10 to 11:30. It will also be through this webinar platform, so you can expect to receive those meeting reminders similar to what you have been receiving from Rebecca. And I think that it went pretty well today, despite having initial technology challenges. But we look forward to hearing from you, and we look forward to you joining us in our next meeting, which again is August 6th. The next meeting after that will be September 12th, which is a Thursday, from 1 to 2:30. And after that, we will move to bi-monthly meetings, and we plan on procuring different agenda topics in order to provide some of that training or information that similar to what somebody mentioned regarding motivational interviewing. Some content has been developed by the American Association of Diabetes Educators that we will be presenting and drawing on their expertise. So look for more information about that. And I think that's all I have, unless anyone has anything to add before we close out our session. And we will send you all of the PowerPoints and slides that we reviewed this afternoon. Well, thank you, everybody. Thank you so much for your time, and I look forward toward any follow-up that you may have via email. Thank you. Thank you, Victor. Bye-bye.
My pleasure. Bye.